My name is Ryan Ramsdell. I'm a community health paramedic with REMSA. I've been a paramedic for 10 years. I chose to apply to be a community paramedic because working in the streets for almost 10 years, you see the gaps that are in the healthcare system. And this gave me an opportunity to maybe try to fix some of those gaps.
CP1, you can show me a note to the call on 6th Street.
That's really why I wanted to be involved in this, to try to help make a difference in my community and try to lower the amount of 911 use and the people going to the emergency department for their general healthcare needs. You know, most people readmit because of not knowing what to do, not understanding their medications, not taking their medications. And those are all things that we really try to strive to encourage our patients to do.
Need to breathe too real quick.
So Ron, he has a defibrillator vest on. And so the first few weeks that he was home, he was very uneasy, uncomfortable, wasn't sure about the device that he had on. And being able to just kind of talk to him and explain to him what the device was for, why it was there, how it works, letting him know that it was okay to take it off and be able to take a shower, and that wasn't going to kill him. It was okay for him to be able to do that, and that when he put it back on, you know, everything was going to be okay again.
You can always call the nurse helpline too.
And so just being able to give him that reassurance, I think, was really, really unique to him. Being a community paramedic is a really big change from being a 911 paramedic that responds to 911 calls all the time. There's a huge change in the way that you have to look at your patients, instead of from a 911 perspective to actually being able to treat somebody and leave them at home, and understanding that your treatments have to be safe and appropriate, and you have to do them in a way that isn't going to put the patient at risk. Earl, he's very unique because the first time that we saw him was about a year ago.
How you doing this morning, Earl?
And he was very skeptical about what we were doing and the things that we were trying to teach him.
I didn't understand everything about it, but I thought I was still bulletproof, and I didn't really need this, so I was going to be all right. And, you know, I don't want to waste your time. You're wasting mine. I got other things to do, you know, and that was a big mistake. I should have paid attention more.
Yeah. You're down a couple pounds, though. That's good.
Yeah. But this time here, it's totally different. I understand what's going on, and I needed it. It's like being in a hospital. I mean, they come by, they check everything for you.
So I'm going to put you on the monitor just to look at your heart.
When they leave, you know where you stand. You know what's going on. You know if there's something wrong, they're going to report it to the doctors.
You know the drill. Sit real still. We'll take a quick picture.
And if these figures don't match up, they want to know why. So they start asking questions.
How's your fluid intake been?
I've been up to 5 bottles.
Okay.
So I'm just thankful they have the program, because I'm not the smartest idiot in the world, you know. I just forget, or I don't pay attention. And by the time I realize there's something wrong, it's already down the road too far. So I end up back in the hospital.
All right. Little pinch.
But with these guys coming by and checking me all the time, it makes it so much better. It's saving me from going to the emergency room. But I'm doing everything I'm supposed to do. I'm staying away from all the silly food that I really, really like, you know, and it's hard. I'm from Boston, and, you know, a loaf of bread and a stick of pepperoni, and I'm happy. Can't do that anymore because it's too much salt. But I didn't know that before. I wasn't paying attention to that. Now, if you look in my food cabinet, everything that I buy has got low salt in it. But I'm getting better at everything.
And then breathe easy.
To be able to see the change in his attitude, how he's much more willing to follow a care plan and really try to improve his health knowledge, has been a tremendous help to him, because now he truly understands that we're there to help.
Take good care of me.
We try to.
So that's the most rewarding thing, is being able to treat patients that you can leave at home and know that they got the same care that they would have gotten in the emergency department, but they didn't have to go through the emergency department to get that care.